In today's episode of Quick Hits, we're diving into the transformative world of digital healthcare with a very special guest, Dr. Shafiq Rab. Dr. Rab is at the forefront of digital innovation at Tufts Medicine. And during this episode of Quick Hits, Dr. Rab helps us come to a better understanding of the mechanics of digital transformation, as well as envisioning a future where technology and healthcare converge to create unprecedented patient outcomes and experiences. We explore the complexities of data lakes and how they enable researchers, clinicians, and patients to access data more efficiently. Then we unravel the strategic nuances of AI in healthcare, and finally uncover how Dr. Rob's leadership is leading the way in patient care. Ultimately, Dr. Rob helps us to have a deeper understanding of the role AI will play in the future of healthcare. His passionate commitment to improving patient care through advanced technology will enlighten and inspire. Join us as we go deep on the future of healthcare, the pivotal role of digital transformation, and the innovative strides being made at Tufts Medicine under Dr. Rob's leadership.
Well, welcome to another episode of Quick Hits. I'm your host, Ken Booth, joined as always by my co-host, Tyler Smith. Tyler, how are you?
Excited to be here, Ken.
Absolutely, and you should be. We have an excellent guest today. Today we're going to be interviewing Dr. Shafiq Rab, and he is the Chief Digital Officer and System Chief Information Officer at Tufts Medicine. And he was also just named the 2024 CIO of the Year by the College of Health Information Management Executive. So, Dr. Rab, it is a pleasure to have you on the Quick Hits podcast.
Oh, well, thank you for having me. It's a pleasure and an honor to speak with people and also allowing me to be on your podcast.
Oh, absolutely, and we know you're passionate about AI, so we're really excited to talk to you about that. We thought first, though, our first question would be basically, Dr. Rob, can you share some specific examples of how your digital transformation and healthcare innovation work has directly improved patient healthcare or outcomes at Tufts Medicine and even beyond?
Digital transformation is key, it's an enabler. But what has not changed is that our processes and workflow have to be improved. What has not changed is that what are we trying to solve or what is the pain that we are trying to take away has not gone away. What has not changed is that the cost has to be decreased. And cost can only be decreased by standardization and automation. But a standardization or automation cannot happen without change in workflow and processes. That cannot happen without actually sitting down and talking to the end user and trying to improve and bring transformation and change management. With that in mind, what we have achieved at Tufts Medicine so far are three very important things. One, we have cloud enabled many things, including our electronic health record, which is Epic, and the ecosystem that means about 239 applications. We put them into one place in AWS so that we can use the compute power in AWS. Second, what we have done is that we have created a digital front door so that the access to care is possible. And we are embarking upon a new trend in which we say virtual first. Third, and most important thing that what we have done is that we have created a lake house uh, and converted 28 electronic health records into one, 110 patient portals into one. And we, by doing that amazing thing, we have enabled our researchers to do research, our clinicians to access data, and our extraordinary people who take care of patients and who help us and the patients themselves to have access to the record. So those are the three things we have done. And most importantly, after that, we took care of our ERP system and we went to one system from nine.
Mhm.
So this is a part of the digital transformation. We are on a journey. We're not done yet, but we are doing it together without creating chaos and working with our people who are the real heroes, not technology. Technology is just an enabler.
That's an excellent philosophy. I appreciate that. You alluded to this being a journey, and so that that indicates that we're talking years in the making. When did Tufts first start moving their data to the cloud?
So if I tell you that's only 2 years ago.
2 years. Okay.
maybe 2.5 years. Yep.
Okay. And you already talked about some of the benefits of moving to the cloud, but as you know, obviously there's that need to ensure patient privacy. So how do you balance the need to innovate with ensuring that patients' data is secure and private?
So I'll answer in 3 to 4 different ways, but the most important way that I answer, whatever we do, whatever we think, whatever we ever try to do at Tufts Medicine, the single most important thing is our patients, who we call customers. Patient comes first. We do in keeping that in mind, that whatever we do should benefit our customers and our patients. And we believe that 10 years from down the road, when we look back, we have to decide whether our decision was right or not. So, having said that, the other way of defining it is that we believe that most of us are already using cloud today. Some of you buy stuff from Amazon, some of you do online banking, some of you use JP Morgan, some of you use Bank of America. Some of us also do music from Apple and other places. It's not that people are not using the cloud. The idea behind is that to make sure there's end-to-end encryption, so there is nothing data on the move or data at rest is not encrypted. On top of it, we believe in cybersecurity, even though it's a very arduous pursuit and there is not a single moment of relief from it, yet that is at our forefront. On top of that, we also have MFA, all those standard, which we call it NIST standards. We follow that, and we have a very vigilant group of people who make sure that the HIPAA privacy laws are in place and all those necessary things that has to be put regulatory, and most importantly above regulatory, that how we respect the sanctity of the data that has been provided to us by the people who come to see us in the most vulnerable time. So we take this very seriously.
How do you maintain that vigilance? What's your philosophy, or how do you train your team to take cybersecurity as seriously as it should be?
So we have tools. It's not that we're just sitting here twiddling our thumb. Basic thing is patching. Everybody does that. Basic thing is running logarithms using machine learning.
Hmm.
Basic things are that we get attacked every day. It's not that we don't. We have companies like CrowdStrike. We have companies like so many companies that we have a layered defense which we practice. Sometimes there is phishing. Sometimes there is other ways of people trying to figure out people's password. So we have multi-layer nest guideline strategies that we deploy, and some we can tell you, some we cannot, because we are always under threat. So that's how we have a cybersecurity defense mechanism. We work with the FBI, we work with other government agencies to learn from it. We learn
Hmm.
from CISA, which is the federal government places where they give us information and we react to it. Some of it is proactive also.
Being reactive when it comes to cybersecurity obviously is you're failing already, but yeah, it's great to hear, especially since you're so adamant on pushing things to the cloud, which is kind of really what we want to focus on today. So
So sorry to interrupt. Just to let you know, cloud is more secure than on-prem at any given day,
can you explain why?
because the responsibility of protecting data on us is from our data center or
Hmm.
our places into the cloud.
I
After
see.
that, it is the responsibility of the cloud providers to provide the cybersecurity or any other security.
And they're going to have resources that even a medical program like Tufts just wouldn't have.
Well, the Magnificent Seven, which was coined by somebody about long time ago, they control the stock market,
Hmm.
they control the economy of the United States, whether it's Alphabet, whether it's Amazon, whether it's Tesla, whether it's companies like Nvidia,
Hmm.
company. So they do have resources. There is no doubt about it.
So I imagine, so your data's secure, it's safe in the cloud, and now you get to benefit from the research. You referenced earlier, you talked a little bit about machine learning. Why is AI or AGI and machine learning so important in the healthcare space?
If you want to do AGI, or if you want to do machine learning, or you want to play with generative AI, the compute power is important. And the compute power could be CPU, could be GPU, could be TPU. All those are important. And the only place you can do scale is the cloud, not in your basement, unless you own a supercomputer. Why is it important? Why is not important? The question that you are asking is very simple. uh, Single most important thing in the world is trust,
Hmm.
and it's very hard to gain trust. And in the day and age that we live in, the hype started with generative AI, and and then all of a sudden everybody got interested in AI, trying to figure out that how do we benefit uh, from the vast data that we have. So before that, it was hard for us to fathom that we could do petabytes and terabytes of data and put them into a place, structured, unstructured, semi-structured, in their natural format and in an object format, and we can do analysis on it. Because before we were happy with data warehouses where people think should have been in a structured way. That opportunity started with the March 2022 when ChatGPT came into being. And then everybody came up. Bard came up, Bedrock came up. Bard came from Google Alphabet, and Bedrock came from Amazon, and everybody jumped into that world. So in a place where you want to do drug discovery, in a place where you want to understand what are the needs of our patients, in a world where you want to analyze and understand information, started with text, then we started introducing images, then we started introducing sound. So from a single mode we become multimodal AI, so that we can get to a place where we can actually benefit from it. Then came large language model, in which we have the entire ontology of healthcare, trying to put them in one place so that we can change the context of the electronic health record, and we can actually dictate, and we can actually summarize, and we can actually generate the output for the patients to take home. All these things started happening. So when you're asking why you need machine learning, is that even before you need machine learning, you need to clean your data, you need to structure your data, you need to go to multiple resources and have a data governance committee, you have stewards, because without that hard work you can't have a data to analyze, and you can't have wrong data to analyze. On top of it, you have to understand what are the things that makes a data wrong or right. That means you have to be aware of the social needs, you have to be aware of your biases, you have to be aware, because the more complete the data is, the better the answer comes out, right?
Hmm.
So while you're working on that, you put that data in a cloud format where you go and you start analyzing it. But even before you analyze it, you have to somehow teach it. So that's what machine learning is. For a child, it recognizes a hot dog. For a machine, you have to have multiple types of stimuli for it to remember that this is a hot dog. That is the hard part. Once you have done the machine learning, then you can run predictive modeling on it, then you can run AI models on it, whether you can do narrow AI, you can do artificial general intelligence, and if you want to be really super crack at it, then you can do artificial super intelligence. And then the memory of the machine learns it, understands it, and then we come to a place, and then the models change. So it's a very iterative process, it's a long process. Most importantly, it's an expensive process, because
Hmm.
nobody everybody cannot afford a GPU or a TPU.
TPU. Yeah.
I hope I answered your question in a very long way of why machine learning is important. Machine learning allows us to do one very important work, which is automation, both supervised and unsupervised. That's how you improve your processes and workflow.
Well, I was going to ask a little bit more about like so that automation. When you talk about supervised versus unsupervised, can you give us some examples of the two?
So very simple. In the world of revenue cycle, you want a clean claim. You can only get a clean claim if somebody puts his eye on it, and actually sits down and looks at, suppose, eligibility,
Hmm.
suppose looks at the contract. But it's a manual work. If you put a bot on it, the bot can go look at the eligibility and can look at the coverage, put it into the claim, says it's clean and sends it. You can, and the bot never sleeps. Bot also works at night, at day, and bot does not argue with you either. So I'm just trying to tell you that's one simple example.
Hmm.
But you also wanted to tell you, when you're sending your claim, which claim will be delayed and which claim can be slowed. So there are variables that help you understand it. Similarly, if you're sitting in a ED and waiting and people are leaving without being seen, you can create a bunch of variables, and then you find out, predict which three patients will leave without being seen. So you can do a predictive model, and then you teach the machine to learn it, understand it, and generate ideas about it, what you can do to not let people leave them the ED without being seen. As you are doing it, because what is the difference between artificial intelligence and predictive modeling? Artificial intelligence generates new data, new insight, while predictive modeling just predicts based on the old data that you got. Now, I'll give you one more specific example, that trying to find a cure for certain diseases, drug discovery. Artificial intelligence is a very good tool, from machine learning to artificial intelligence, that it allows you to find new drugs, new ways of treating things. So that's a new data that is generated.
When does that new data eventually help with the predictive modeling, or will the two forever be separate?
So let me walk slowly. Predictive modeling is beginning, and new and artificial intelligence using that new data as the end, so that you understand. And new data cannot happen without machine learning, and without having all different types of data in place, without your biases, and there's a lot of ethics behind it too, that we are all afraid of. And trust me, the machine is not taking over yet. So it's a long journey. Everybody thinks everything will happen in 5 minutes. It's not happening. Like, for example, there is a we do gene therapy for factor VIII deficiency, which is a bleeding disorder. So the cure is there, but the patients are not there to take the cure. So what I'm saying is that it's a societal thing. It's not that easy, that people think that artificial intelligence is taking over and everybody can afford it and it will happen immediately.
Yeah, Dr. Rob, it's great to hear you kind of dispel these myths. Yeah, that everybody can afford it, that it's coming so quickly. Ballpark, over the next 10 years, what do you expect will get adopted in healthcare? And how close will we be to AGI at the end of 10 years, too? I'll just throw that in as a secondary question.
So your question is right on. So what is the so presently everybody's hyped about generative AI. So I'll start with that. See, the thing is, we are thinking that the machines will become human like, right? That means they can do social and emotional sensing. They can do social and emotional reasoning. They can do social and emotional output. They can do sensory perception. In my mind, that is far away. That's not here. What machine can do today and go forward is coordination with multiple agents. It can talk to 4 or 5 people. It can do creativity. It can do some logical reasoning and problem solving. It can do natural language generation, natural language understanding, output articulation and presentation. These are things are possible, and it'll take at least 10 years to perfect it. Because here's the thing, we still have to have guidelines. Uh, the president has set up a group of people to follow ISG and couple of other institutions to follow certain safety guidelines. The European Economic Commission and European people are also coming with the guidelines to follow behind it. So if you're asking, that LLM will become very popular for medical world, uh, and use of artificial intelligence will become popular after we have taken care of predictive modeling. The third thing that's coming is clinical decision support. So the FDA will govern that, because you can't do harm to other people. So safety measures will take about, in my mind, 3 to 5 years. Initially, I was also part of the hype, and to perfect it will take 10 years. By which year is this? 2023. So by 2030, we'll be in a better place than we are together today. But at least natural language processing, LLM, coordination with multiple agents, and creativity in place. What you will see the use of automation. What you will see, technical automation will come quickly. What you will see in healthcare, that agents that we use that will come quicker. What you will see is that will not only use text, but it will help us in code generation,
Mhm.
in image, especially with the new tool SOAR that came out, that generates a 1 minute video by your text. If you say a text, a tiger is walking in Dr. Rob's house, it will generate a video based on that. Audio will be used, and 3D and video, they will be used faster and quicker in my mind. In healthcare, it will help us make our revenue better in the next 2 years, 3 years, because people will move from predictive modeling to generative AI, and there is a place for generative AI. People are using LLM models and generative AI. The true use of AI for R&D and other things, that's about 3 years away, because safety measures have not been taken care of yet, and the policies and the rules have not been finalized, because those are very important. While outside the United States, people are doing a lot of things that they're supposed to do, the biggest thing that you will find out is research and drug discovery, customer documentation generation, and also you will find marketing will be an advertisement will go faster than anybody else.
So when you say revenues will improve, I'm cluing in on the marketing for healthcare systems will improve, and then the care quality and care volumes, or how am I missing the mark?
So I think there's a direct 3.2% in my mind to 4%. You will see the increase in revenue. People who are using these tools will come to use that tool, because it'll tell you more about your customers. It will also tell you more about your efficiencies within your own institution. It will tell you all the inefficiencies you have, and this all depends upon how well you have made your data infrastructure right. And the other part is that it will force collaboration between institution. Why? Because one institution data is not enough. You will need multiple data to come together to come to an inference. You know what I'm saying? Because that's why we call it large language model. The large first part means large. So I think you will see more collaboration between academic medical centers, which they do already today, and you will find out that more companies will come out of that, in which 6 7 institutions go together to come to a solution.
Well, I have to say I'm disappointed that the singularity is not already upon us. So,
Singularity is
Okay.
not near, according to Dr. Rob.
Let me tell you something. With what I know today, it's not possible. But
Mm.
tomorrow you can start quantum computing, and then you come up with something else. Things will change, because
right.
we are all looking for that window into humanity. We're
Mhm.
looking for that. We're looking for cures. We're looking for solutions. Uh, but we're looking to travel. Already, you see the travel industry is using that,
Mhm.
and also retirement industry. So, but true nirvana, it'll take a little time, because it's very costly. Until as the cost comes down, it's hard, man. I
Mhm.
mean, I'm just telling you that.
We think about some of the challenges that at least the average user has with a large language model. I think Chat GPT or Bard. How do you keep, if you're looking for a cure, if you're looking for a new drug, how do you keep a large language model from just hallucinating data? Because that happens a lot. I
Okay.
use it for coding, and it hallucinates API or function calls that don't exist. So how do you keep that from happening?
So first of all, I'm not that smart that I can build a large language model, but I use other models, both open source, both free, as
Mhm.
well as provided by Amazon, provided by Google, and provided by Microsoft. Friends of mine. So it's not that I don't use their software. I do that. My thing is the following. My request when you are asking this question, anybody who's listening to this, go home, go to your institution, start cleaning your data. Second, start knowing your definitions of your data. Get an alignment on that. Third, get your ontology right, get your semantics right. Then find all the sources of data that you have in house and then start layering it up, both structured, unstructured, and semi-structured. You can't like ignore that, because that's kind of important. Then some of you have data warehouses, some of you don't. Some of you who don't have it, get a data warehouse. If you have a data warehouse, improve it to a lake house. You have to go into the cloud. There are two three major lake house companies. They use, some are with Microsoft, some are with AWS, some are native, whatever it is. Because when you get to a lake house, and when you're getting to the lake house, get to a structure like fire, FHIR, so
Mhm.
that you are interoperable, and then put a semantic layer on it. So build that. If you build that, then you are AGI ready, you are API ready, you are ASI ready. That is the basic infrastructure. Then you sit down in a corner and look at your electronic health record. There are companies that are building the LLM for you. You can either participate in it, or you can buy that. For example, go buy John Snow Lab. It's not that expensive.
Mhm.
Or buy some other software. And then work with your end users and work with your electronic health record company to put those things in it. Orders, start with orders, starts with result. So that you got to start somewhere, you know what I'm
Mhm.
saying?
Mhm.
And then you build on it, and then you iterate on it, and you're on your way. But when you're asking, it's not that Bard is going to stop developing. It's not that cloud is going to stop from entropy is going to stop doing it. It's not
Mhm.
that chat GPT is not going to innovate. It's not that AWS is not going to stop innovating. They will all. And a day will come, either you partner with them and do things that you need to do, but until you are smarter and you're extraordinary people, you can build your own LLM. A lot of people have gone through open source LLM.
Mhm.
They also do their job, but the idea behind is that you can't feed that much data without having money or a place to go find somebody to rent you GPUs. So you have
Mhm.
to work through that.
And you mentioned Amazon, or AWS. You mentioned Microsoft. Who would you say is making the biggest uh, entrance into healthcare right now? Is anybody
Hey
looking to
man,
partner?
you're putting me on the spot with my friends.
Uh oh. Okay.
So, but I can tell you, they will all invest.
Okay.
Microsoft came out first, then Google is doing phenomenal job, and AWS has Bedrock and SageMaker and Redshift and Q. Um, Google has Bard, phenomenal, MedPalm 3. So they're all coming out with things. And of course, Microsoft came out with ChatGPT, but they're not giving it up. And then Entropy, which was part of the OpenAI, they are coming up with it. And on top of it, NVIDIA is coming out with their own too. So it's not that NVIDIA is saying, hey, you all have a free for all. So
Right.
each one, because remember, the whole game fight is about the following: the hardware.
Mm.
Mm.
ASML supplies semiconductors. So everybody who has the hardware, Nvidia stock went down today because people are not selling as many as what do you call gaming chips. But
Hmm.
that doesn't mean it's not my favorite. They'll still make money. So what I'm saying is that they're also coming with LLMs. So everybody is coming with a model. What I'm trying to tell you out of this, there is no winner yet. Some have more market share, some came out. Nobody's going to give it away. Why? Because all of us need that,
Hmm.
because the wisdom, the insight that large language models, that machine learning, which with NLP, with AI, will provide for us, it's a big deal. But the biggest part that everybody's not understanding, which I want to convey through this podcast, is that somebody has to believe your data.
Hmm.
That means deep fake. We gotta how to avoid that. Like when we go to see our doctors, we love our doctors. Whatever our doctors tell us, we do, and we get better. So how do you bring that trust? So people have to work on gaining that trust. People have to work on decreasing the biases. So it's a social issue. It's a bigger than that. So therefore, all this Magnificent Seven, which is Meta too, they're all working on getting that market share. So they're all fighting on it. So when you're asking who do you like the most, I like the most who gets to the customers first and gains our trust
Hmm.
by being open, by being transparent. Because all the logarithm that we are using today, sorry about this, all the logarithm that we are using today, which publication it came from, what where did we get the data from? All this has to be made public.
Hmm.
Only then people will trust it. But everybody is in infancy. Everybody is trying to do that. That's why I said, and we all believe that by tomorrow morning, Dr. Rao will say, hey, generative AI is finished and AI is done. Now we know everything about Pluto. No, that's not what it is. You know what I'm saying? It's a lot of work, man.
Sure.
Dr. Rob, it is a lot of work as you made clear, especially even just getting to a layer of understanding. And I guess one of my questions might be around the trust factor. So, from what I can piece together, you have a belief in some type of free market forces will force a solution to come out of the Magnificent Seven, or some new entrant will create that solution. But the adoption by health systems is critical, and while you are, I think you said you're a forefront of the hype cycle. Maybe the hype cycle's died a little bit, but from our conversation, it's clear you still believe in all the possibilities. How do you advise other CIOs or other IT leaders that may not see all this potential or may be hesitant on the adoption to to get closer to adoption and to embrace the technological change that is coming?
So, yeah, it's no different than any other project we do. Start talking about it within your own institutions and start teaching people, sharing with people what artificial intelligence is. Get your legal team, like get your finance team, like get your clinical team. Start talking about it because if the institution is not ready, I as a CIO cannot do anything. I'm just telling you that. So the education of people and the importance of this, we as CIOs and CDIOs have to become their advocate and also try to figure out how it's going to help our business, how it's going to help our patients. That dialogue has to start today. It's not like overnight somebody comes up and say, "Oh, we'll be using AI today, made by the Martians who came into Egypt." We're not doing that. You know what I'm saying? Like people have, it's not like the Twilight Zone TV show we are watching. It's for real. But my request to my colleagues, and like I got the advice from my colleagues, is that start talking about it and start saying that how does it help your business, how does it help your patients, and what pain it is going to take away. That dialogue has to happen, and then the readiness dialogue has to happen. The institution has to be ready to accept it. Institution has to be ready to invest in it, and the institution has to be ready to present it, right? So that doesn't happen in one day. That's a dialogue that may take a year, that may take 2 years. So it's not that my colleagues are now ready to go to the cloud and do a GPU and start working. My colleagues are ready, they've been ready forever, but we have to sell it. You know what I'm saying? And
Right.
also understand it ourselves, that what exactly is it and what does it take to do it. Like
Hmm.
it's not like somebody presses a button, we have it. Our electronic health record companies are also working on it. My Epic, which I love very much, are working on Nebula. They're working on other things. They're participating. So it's a continuous dialogue, my friend, that we have to start working from our internal constituents before we go to our external constituents.
Sure. And I love the concept of dialogue and trust. And it actually makes me think of a conversation Ken and I had earlier on this podcast in a previous episode with Ganesh Prasad at MHS, who you have mentored over the years and had amazing things to say about you. So I guess moving a layer down, or even back to the CIO layer, what advice do you have for CIOs in mentoring the next generation? And then on the flip, what advice do you have for the next generation in seeking out CIO mentors like yourself?
So first of all, thank you, and thanks to Ganesh for thinking that I'm a mentor. He already knew everything from the day I met him. So just to let you know that. But here's what it is: AI is for real. No power on can stop it. Just to let you know that. So what that means is that we have to be real about it. We have to understand it. Gen Z, Gen X, all those, they're already thinking about it. So number one, you have to figure out: do you have the capability to manage that? Or do you need outside to manage it? What kind of skill sets your team will need? Whether that team is clinical, whether that team is operational, whether that team is IT, or whether it's your data people, like you got to figure that out. Because, and the pipeline, where are you going to get this talent from? Do you think chief AIs are hanging on a tree? No, there's a scarcity of that. So that means our job is not only to mentor, our job is to find out how do we make this happen. So where do we get the talent? Where do we get those people? And how do we create the future generation of people who will use AI as we use Microsoft Word today? You know what I'm saying? For
Mhm.
everything that
Yeah.
we have. So that has to be established. And then we have to go to colleges and universities and find out where this talent is. That's one advice. Second advice is talk to each other. We're all in the same boat. Nobody's smarter than the other. Just because I'm on a podcast doesn't make me a smarter person. I need help too. So, and I've not figured out everything myself. So, the peer group is important. Then they follow the Magnificent Seven, as I call them, and because they also have a lot to say. Then the other thing is that for mentoring and other things, people really have to understand that is data the path? Is digital transformation the path? Or is the use case the path? In my mind, application is the winner in all of this. And use case is the guide to the applications. So what is it that what pain that has not changed. So we have to understand now that we have this possibility, we have this new tool that can make things happen that we did not do before. So how can we use that to the advantage of our caregivers, of our staff, and of our patients? How do we make that happen? So that dialogue has to happen. And people, you will find there will be new groups of people, like, when genetics became very common, new job came out known as genetic counselors, who can tell you whether you are BRCA2 positive or negative. People didn't know even how to interpret that. So there will
Mhm.
be new type of jobs, people who understand the interpretation of machine learning and AI. You see what I'm saying? So we have to look towards that. And it's a hopeful world. Even though it's scary now, everybody's scared, including me. Oh my God, what's going to happen? It's scary because we have not overcome it. We have not taken the power out of the scariness because we are still learning at it. So if you keep it that way, the scariness will go away. And of course, there'll be security involved in it and understanding of it. But as long as it meets and helps our needs, we'll get to embrace it. We'll get to understand it.
Love the optimism.
Oh, 100%. Before we could only do certain megabytes of data. Now
Hmm.
we're doing petabytes, and we're doing data that is so big that all of a sudden we have an opportunity and an obligation, and we have the duty to understand it and use it for the greater good of humanity. Of course, there are people who will try to, all kinds of bad people who will come and try to do things, but we have to figure out as an intelligent community, as CDIOs and CIOs and technical people, how to detect deep fake. So there will be new industry that will be developed on this, in
Hmm.
which how to fight the cybersecurity criminals. So there are new jobs and new ways that people will do that, and we have to be aware of that.
Yeah, with you mentioned Sora earlier, and
Yeah.
yeah, I could see how that would necessitate just newer types of security and training and the ability to just identify. Right now we can look at hands, and say, okay, that was generated by AI. But I think we're a few months away. Actually, somebody showed a video a year ago, generated AI video compared to Sora, and it's mind blowing. So
Oh
yeah.
yeah. So the request is, I'm not a pandit. I'm not a person who prophesizes thing. But the request is to overcome all this, learn it,
Hmm.
get certified in it, find people who talk about it, and then always keep patient in the center, your doctors in the center, your nurses in the center, and your staff in the center. That will guide you automatically what is right and how to do it right, and ask for help from each other. So the old principles have not changed, they are still the same. The answer lies within. You know what I'm saying?
Hmm.
It's in your heart. That's what guides us. But the possibilities are tremendous. That's what I'm trying to tell you.
We hope today's discussion has sparked your interest and curiosity in the transformative power of digital health. Remember, the conversation doesn't have to end here. You can continue to engage, learn, and discuss by following Health Data Movers on LinkedIn. HDM makes it possible for us to bring these vital conversations to you. If you're looking for solutions that marry workflows and technology, or have questions about today's topics, don't hesitate to reach out at solutions@healthdatamovers.com. Whether you're part of the healthcare industry or simply passionate about the intersection of technology and health, Health Data Movers empowers patients and providers by unleashing the potential of healthcare data and technology.